Ocala's information station, 1370 WOCA.
Ocala.
It's about 3 minutes after 11 o'clock. Thank you for tuning in. It is time for our Health Matters segment here on WOCA The Source. And we're going to learn some stuff about lifestyles. And this is the one, you know what? I'm so glad this is the topic today that we're speaking about, simply because so many times we discuss things that we can do to improve our health. And then somebody, a doctor or a nurse or somebody who knows about health will say, well, you know, you got to change your lifestyle to have a healthy life. Well, what does that mean? I mean, you have to, maybe we need help with that one. Maybe it's not as easy as just simply saying those words. So we've got some help about that today. And Leah Caruso, good to see you again. Thank you for coming in.
Thank you.
And Leah has invited some guests, and let me introduce you to them. Jeff Gillum, is it Gillum or Gilliam?
Gillum.
Gillum, okay. Jeff, nice to meet you. You are the clinical director of Request Physical Therapy in Gainesville. Thank you for coming down here to Ocala. Dr. Michael Wood, correct?
Correct.
The Doctor of Physical Therapy at Strive, Physical Therapy Centers on American Road out here in Ocala. And Jonathan Halter, Community Relations Director for Strive Physical Therapy Center. So good morning to all of you. And another great topic, actually, because this is the one that seems to connect all the others. The last interview we just did with the doctor had to do with prostate cancer. I don't know if lifestyle really affects that particular one, but in general, lifestyle, I don't know. He did talk about relieving congestion,
yes,
and I've been thinking about that ever since he said it. But it does seem to connect a lot of conditions. Am I right about that?
Absolutely.
Yeah. Lifestyle, and how do we define lifestyle? Is it exercise? Is it eating? And is it psychological in nature? In other words, if I wanted to change my lifestyle, I got to change my mindset, don't I?
Absolutely. Larry, when we talk about lifestyle changes, we talk about behavioral changes, essentially. And unfortunately, this culture makes it very difficult for us with all the temptations around us. Here, we're sitting right here at the food court at the Paddock Mall here, and you go inside, and it's a lot of good tasting foods, but many of the foods are high in calorie, high in fat and sugar. And so trying to change that lifestyle is really critical. Many people will go on these programs where they'll reduce their calorie intake, and they'll focus just on calories. But unfortunately, calorie counting has not been shown to be very effective in the long run, because what happens is people just cut back on the same junk that they're eating. They say, instead of a couple pieces of pizza, I'll eat one pizza every day.
Yes.
And so they actually do not change their mindset here. And what the research has actually shown is that we are all used to eating the same amount of food each day. The gram weight of food that we eat each day. The research has shown in Britain and the Netherlands and the United States, where people weigh the food that they eat about the same gram weight of food each day. Now, the Florida linebacker may eat 5 to 8 pounds of food a day, where the ballerina eats 2 pounds of food a day. Most of us probably around 3 to 4 pounds of food a day, but that's what it takes to satiate us.
Okay.
And so that gram weight of food could either be an apple, which is 100 calories, or rather 60 calories and 100 grams, or it could be a piece of cheesecake, which is also 100 grams, but it's 350 calories. So if we do not change the choices that we make, and we just simply cut back on the calories, we'll end up being hungry, because that's what it takes to actually satisfy us. The one thing is gram weight of food and the nutrients in the food.
So what do you all do to help people with the changeover? And I'm sure there are other things associated with lifestyle besides food, but food seems to be a biggie. I'm sure smoking is in there, and that's probably a given. You just got to quit. That's the one thing about smoking. You don't have to have it at all. With food, you have to have it. So you can have all or nothing with smoking. That's kind of easy, right?
Absolutely. And what's really been shown in the literature is that food choices, food intake, is the critical key element in weight loss and making a lifestyle change. Research has shown while exercise is very important and very good for us. In and of itself, it has not been shown to be very effective in facilitating weight loss in and of itself. But combined with a lifestyle change where we change our food choices, it's the hybrid. It is the key.
So now, weight loss obviously will help you with your heart, will help you with other conditions, diabetes type 2 especially. We heard that in the Veterans Show. What else? Joint problems? Is that, you would think it would if your knees are holding up a lot of weight compared to less weight, right?
Absolutely, yeah. So the research shows that we're looking at osteoarthritis, joint pain, those kinds of things, particularly the weight-bearing joints such as your ankles, your knees, hips, low back, those areas. Even a small amount of weight loss, 10 pounds, 5 to 10% of your body weight will significantly reduce that pain that you're having and also increase your function. So you get out of a negative loop cycle and get into more of a positive cycle where you feel better, so you do more. Well, you do more, so you're spending more calories, you're exercising, you're maybe choosing better foods because you feel better, and so you're not reaching for that comfort food. So then that kind of just sets you up for positive things to start spiraling out of that. Well,
and that spiraling word, that's a good and a bad thing. I mean, we can spiral in a good direction as well as a bad direction,
Absolutely.
Right? And I think that's right. I mean, I'm not a psychologist, but I think if you are on the right track and you see evidence of it, then you get pumped up and you want to keep doing that, right? Yeah.
Well, absolutely. Michael was correct when he talks about a 5 to 10% weight reduction. Studies by researchers like Stephen Meisier, who looked at 316 individuals who had osteoarthritis of the weight-bearing joints, the knees, and who were also overweight. He put them on a weight loss program as well as an therapeutic exercise program, and showed just as little as a 5 to 10% weight reduction. 15 to 20 pounds significantly improved function by 24% and reduced pain by 30%, Larry.
Wow.
So when people go for an operation, whether it's on their knees or a hip surgery, is it wise for the doctor to recommend that you lose X number of pounds prior to the surgery?
Absolutely. And I think even on top of that, kind of the term we use is prehab or rehab before you go in for the surgery. And not only to lose the weight, but also to strengthen the muscles, because we know muscles atrophy when you have surgery. So if we can build them up prior, then your recovery afterwards is going to be less painful and quicker than before. But taking the load off could actually cause you to postpone that surgery several years. So, if you're looking at a younger person who's needing a total knee, by losing weight, we might be able to prolong 3-5 years out so that prosthetic knee would last them into their late adulthood.
Oh, wow. Jeff?
Robin, that's a good question. When we talk about weight loss, many of the physicians will refer to our clinics with patients that may be certainly a candidate for joint replacement, but they say, you know what, let's go through physical therapy and go through the healthy lifestyle weight loss program that's offered at Strive and Request Physical Therapy. Right. And you may see that we push this joint replacement off. In fact, research has shown just as little as a 20-pound weight loss actually has shown to actually not reverse, but actually slow the progression of osteoarthritis of the knee with when they compare it with those that did not lose 20 pounds in the study, that actually there was an improved quality of the cartilage as well as the thickness of that cartilage. Now, once again, we don't reverse that osteoarthritis, but we can slow the progression of osteoarthritis.
That makes sense. So let us be a fly on the wall. I'd love to hear what the conversation is like. Somebody's sitting with you, one of you, and you're telling him you need to change your lifestyle. But how do you make them do that? I mean, it's easy to hear it, it's easy to understand it, and then as soon as you leave your office, there's the golden arches. Next thing you know, you're back into the same thing you've been doing all day long, right?
Right, and I think there was a key word you used there. How do you make them do it? And the reality is, you can't make anybody, you can't force anybody. We see majority of America is on a diet all the time that they've been recommended, or try this, try that, but those don't work. So it has to come from the individual. We can show them how to do it. The old adage, you can lead a horse to water, but you can't make them drink. So we can give them all the tools, but they have to be vested in the program as well, and to really make it work.
Is the tools for the last guy the same tools for the next guy, or do you look at each person and say, you know what, you need to cut back on pasta, you need to cut back on cheese? I mean, do you know Is there...
Larry, that's a good question. You know, we all have impulse foods that we're drawn toward. And once again, this culture, this society makes it very difficult for us here because these food industries clearly know what they're doing. Absolutely. And they make this food delicious, so we want it. And we're hardwired to want that high-fat, high-sugar food. For years, for thousands and thousands of years, that's what kept us alive. So we have a gene that pulls us in that particular direction there. So when a person goes out in this society, this culture, he's bombarded on every corner by a McDonald's, by a Burger King, by a Cinnabon, by the high-fat, high-sugar foods. So what we advise them, first of all, there's some main important principles that they need to put in place. They need to change their immediate environment. Their home, they need to make that a safe place. Because if they have an impulse food in the house, sooner or later, they're going to eat it there. If they have that half gallon...
I think you're right, yeah. Everything tastes good when it sits on a Ritz. Remember that? Everything tastes good when it sits on the Ritz? I put everything on the Ritz just to try the theory. I wasn't sure.
Absolutely. Larry, if you have a half gallon of ice cream in the refrigerator, you tell yourself you're going to just have a scoop of that every other day. It turns into a bowl or 2 bowls. In the course of 3 days, the half gallon's gone. You know, it would be the same thing if an alcoholic was trying to quit drinking and put a 6-pack in the refrigerator. How long would that last?
Oh, I think you're right, yeah.
So trying to make their immediate environment a safe place, whether it's their home and their workplace, is very important. Trying to change their environment. You know, knowledge is important, but knowledge is not enough, and that's been shown in the literature. Simply knowing is not enough. I have doctors that come to my program for weight loss, and they know a lot of these facts. People, I mean, the lay literature is full of good suggestions.
Right.
However, the behavior has to change. You've got to help facilitate a behavior change, and that's the program that we offer. It's a cognitive and behavioral program, and so not only do they get educational material that teaches them about what's good food choices, what's appropriate exercise, but there's also behavioral changes that are made in the person's life by following these principles that we set out and we teach them.
And that is very important. I mean, you use that word lifestyle because when we go out to lunch or something, we'll go to an Oriental restaurant and they're so tiny and everything, but they're living here in America and they have this one particular lifestyle outside of the sumo wrestlers, you know. I mean, they're just really thin and everything.
And they
the
don't
Buddha
seem to be bothered. On the counter. He's obviously not from the same culture, that Buddha guy. Hope I didn't offend somebody.
So they don't succumb to the Western way of eating then? That's amazing.
No, when you talk about traditional Asian food, traditional Okinawan, some of the, a particular society it's been shown to have the largest number of centenarians in their society. So longevity is a part of their life, and so when we study that the foods that they eat have a low caloric density to them. So the energy density of the foods that they eat are very low. Mm-hmm. They eat things like vegetables, fish. It's not foods that are fried and refried with high sugar contents to them.
Except for General Chow's chicken, that sounds that's pretty fatty, I think. I'm not sure. So far we've been talking about healthy lifestyle regarding weight loss. It sounds like that's pretty much what we've been talking about. Let's talk about the guy who's in perfect shape, like you three guys. Okay, are some lifestyle changes recommended for a guy or a lady who doesn't really need to lose weight? Just simply maybe they've got something else going on that lifestyle changes could help with?
You know, what's real interesting, Larry, when we talk about a person's BMI, body mass index, which is their weight divided by their height, the literature has shown that someone actually could have a healthy or normal or optimal BMI but still be over fat, actually carrying too much fat, and actually be at risk for heart disease. So yes, trying to change people's lifestyle, even those that would appear to be thin or fall in an optimal BMI range, is very important.
Oh, really? And how do you measure that?
The BMI, that measure the BMI.
Well, the fat content, is that the same thing, BMI?
Now, that is two different things. And measuring the fat content, you can do in a variety of ways. You can do with underwater weighing, which is an indirect way of calculating their body fat. Electrical impedance is another way, or skin fold calipers is another way to measure body fat. They all have a plus or minus margin of error here, but the BMI is the accepted way to predict a person's risk for diseases. The BMI has categories of normal or optimal weight, overweight, obese class 1, 2, and 3, and that's been correlated with the general population's risk for diseases. That is, as their BMI goes up in the various categories from class 1, 2, and 3, so does the risk for variety of diseases like diabetes, osteoarthritis of the weight-bearing joints, which we address in our clinic, high blood pressure, coronary heart disease. So those diseases are increased. That is, the prevalence are increased as the BMI goes up.
And Jeff, your clinic is called Request, right?
Request Physical Therapy is in Gainesville, and we're located out of Gainesville Health and Fitness.
And Strive is here. Are they like the same type of therapy? Are they two different things? And just let me slip in another question, if I could. Would somebody listening right now who wants to lose weight be able to just walk into Strive or to Request and say, you know what, can I have some help with this problem?
Yeah. So as far as type of therapy, they're very similar. I had the pleasure of spending 10 weeks with Jeff in Gainesville, kind of studying under him and learning the program. And we share a lot of the same philosophies as far as treatment goes. So yeah, they're very similar. And as far as your question about whether or not they can just walk in, that all depends on their insurance.
Oh, okay.
So some insurances allow us to treat without a physician referral. Other types of insurance, you would need a physician referral. But if you just call up and ask, and the front desk at either clinic would be able to direct you whether or not you could be seen straight off the street.
So it's not exclusively physical therapy that follows another medical procedure, surgery or something like that?
Absolutely, yeah.
It could be, the physical therapy could be absent of anything else.
It could be to prevent the other things, such as surgery.
All right,
yeah.
so let us hear that conversation. I'm coming in, I'm going to ask for some help. What do? You weigh me, I'm guessing, you check the BMI, and then what? You make a suggestion? Or do I keep coming back every week? Am I on an exercise bike? What am I doing?
Yes, all of the above. So what we do in the initial evaluation when you come in, we would get your weight, your height. We do a comprehensive orthopedic examination, figure out what's going on, what are your ailments, what are the causes of those ailments, whether it be strength or flexibility, things like that, and then we start you out on the program. We go through, kind of teach you a little bit about the BMI, show you where you fall, the risk associated with where you fall, and then set some goals. The research has shown, if you want to achieve something, you've got to put it on paper. So that's one thing we help you do, is come up with goals on paper and have you put those up around your house.
There's psychology involved again, right?
Absolutely.
Yeah.
Soldiers and astronauts, they each have a profession that they kind of eat out of the norm. How do they each stay healthy in their own particular environment, like space or on the battlefield, without getting exhaustion?
That's a great question, Robin. Both these professions live in controlled environments. Obviously, a soldier is a controlled environment. And your question would pertain to how do they stay healthy on the battlefield, or how they stay healthy just as a soldier?
Yeah, and astronauts too.
Well, what they'll have to do is
Robin thinks about astronauts a lot. I've noticed this has come up a lot, this astronaut thing.
Well, this, while not completely out of the realm of what we deal with, my background is exercise physiology and nutrition, as well as health behavioral changes. But they have to actually balance their caloric expenditure with their caloric intake. By eating whole foods as much as possible, the soldier can provide enough appropriate macronutrients as well as micronutrients to sustain his body, to provide health. The astronaut lives in an interesting environment where they have to bottle their food, tube their food, and it's an interesting thing if you're talking about living in outer space there. But the same goes for them. They have to have an appropriate macronutrient as well as micronutrient intake to sustain their body and to maintain health in regards to the calories they're expending, the calories they're taking in, and everything else that's needed in there.
Now, when we talk about lifestyle reversing the bad stuff, we know it can reverse weight. We know it can reverse maybe some other things. Are there things you mentioned before that doesn't reverse everything, right? Can it reverse diabetes?
That's a great question, Larry. The research has shown just as little as a 5 to 10% weight reduction actually has reduced the prevalence of diabetes significantly, up to 50% actually.
Wow.
And in our clinic, what we see is patients that lose as little as 15 to 20 pounds actually we watch the blood glucose fall, and their physicians are able to take them off of some of their diabetic medication as well as blood pressure medication. So what we know is not only blood glucose levels drop, but we see also systolic and diastolic blood pressure drops with weight loss.
So would the person who loses 15 to 20 pounds because he cut calories but didn't change the type of food, he's still eating the fatty foods but less of it, be less better off than the person who lost 15 pounds by getting more salads and more whole foods like you just described?
Both of them would benefit from the weight loss, but the problem with those that just simply followed a caloric and didn't change his food choices, he is more apt, or she is more apt, to fall back into old behaviors and
because you're still there, you're still eating it.
That's right, and you are pulled back to the same amount of weight, or rather gram weight of food that you used to eat. So while you'll cut back on the junk, all the crap that you're eating now, and lose weight, you'll eventually progress back to that same amount that you used to eat. But if you can change your food choices so that the caloric density is much less, you'll benefit for a long term. And of course, the tagline of our program is more than a weight loss program; it's a lifestyle change.
That's what we're talking about. We years ago, before Tony Robbins was really a household name, we had him as a guest, and he said that he was heavy before he kind of got started.
Oh, sure.
And he decided he was going to give up pizza, because pizza was his one big bad thing that he would always go to. And he didn't think, how am I going to live my whole life without ever having another slice of pizza? And at this point, he was 4 or 5 years into it. And he said, you know what? I can't quit eating, but I could quit the bad thing that I was eating, which in his case was pizza. I think in my case, it's mayonnaise. I threw out the helmets. Gone. Gone, right, Robin? No more helmets. Yeah. And just like an alcoholic, it was in the house. So I got rid of it.
That's exactly right. When we talk about bad food, some people say, I can't ever have an ice cream cone again, a piece of pizza, and that's not the case. Sometimes when we talk about lifestyle changes, we think, if we can't ever have that, is that really worth that? But the key here is this, is that, no one goes home every night and eats 3 pieces of pizza, 2 bowls of ice cream, a bag of cookies. What it is, Larry and Robin, is it's once a week or twice a week, it's a couple slices of pizza. Once a week, it's a thing of fries. Once a week, it's a hamburger. Once a week, it's a bowl or 2 of ice cream. Once a week, it's a couple cookies. Once a week, it's a bag of chips. But you see what's happening.
Yeah, right,
and the researchers have shown it's a mere 100 calories imbalance per day that puts most Americans overweight. But 100 calories a day is 10 pounds a year. That is less than a pound a month.
Wow.
So in 6 months, you're up 5 pounds. Clothes are a little tight. They get a little tighter at the end of the year. You get bigger clothes, and you're good. It's not until you look back at old photographs that you say, oh, my God, what the heck happened here?
I know that. I've done that. I definitely have done that. I don't know what else to say. All right, so we want to know so right here in Ocala, we can go to Strive, or if we're up in Gainesville, we can go to Request.
That's right.
And we need a doctor's prescription or no? I'm just trying to make sure I understand this. We just show up at the door and...
Right. So again,
ask. Ask for help.
Just ask. Well, call and ask. But let's say that you did go to your physician and you wanted to bring it up to them, get their opinion on losing weight. Are you overweight? Maybe you don't know. So, go to your physician, talk with them. If you're having any kind of knee pain, ankle pain, back pain, things like that, plus you need to lose a little weight, then, say to your physician, hey, I want to make a change. I'm having this pain. I heard about this program, Strive Request. They can, help me out, and just have the physician put on the referral that they send over that, hey, I've got some knee pain plus want to do some weight loss.
Can I ask you a question about guidelines? When every once in a while there'll be a news release that there's some new guidelines that have been released. Why every year do we have some new ones? Do they learn new things along the way? Or?
Larry, that's interesting that you asked this question because they just came out with some new guidelines last week. The American Heart Association has set new guidelines, 2013 guidelines for physicians. This has become such a national problem and epidemic that the groups out there that actually are in charge of this have say, listen, we have got to do something about this. So the mandate is for all physicians to assess their patient's BMI and refer them to a behavioral lifestyle intervention program. And some of the other guidelines is that the program should actually see the patient or referral at least 14 times in a 6-month period.
Oh, wow.
It should be face-to-face. Is much better than on the telephone or online. And it should be, once again, a behavioral intervention, a lifestyle program here that it will be ongoing with the patient there. And what's the great thing about it is our clinics provide just that. The patient comes in, we assess the BMI, we actually talk to them about risk related to being overweight or obese, and then we instruct them on a comprehensive educational and behavioral lifestyle program. So we do all that for the physician. All they need to do is refer to us.
And that helps them.
Listen, they don't have the time, Larry and Robin. You know, these physicians are so busy with this change in healthcare system that's going on out there, the push to see more patients with less benefits, and it's a real problem. So we can really help them with that.
Jeff Gillum is here. That's who you're listening to right there. Dr. Michael Wood is here, and your phone calls are welcome, correct? Are we doing phone calls?
Absolutely.
Let me go to the phone, see if we have any questions out there. Good morning. Thank you for being patient with us. You're on the air.
Okay, that's okay, Larry. Thank you. This is Ann. I don't know. I came in kind of in the middle of this, but I noticed on the front page of our Star banner today, it says, Key to Long Life, ? Studies nuts. And evidently it's the research claiming that people who eat tree nuts, I guess like walnuts and almonds and things like that, live a longer life. Have you read the article, and what do you think of that? And I guess I'll hang up and listen to what you have to say about it.
All right, thank you. Yeah, I read the article. I saw it too. I'm curious too. You think we eat more nuts will live longer or live better?
Yeah, so I've seen the article as well, and I think the key there is nuts, they have a lot of fiber in them, and they also have the good fats that you hear on all the radio and TV and stuff. And fiber has been shown in the research to be one of the things, along with protein, which nuts also have, that help make us feel full, satisfy us. So I think that's probably the route that article is going, is you eat a few more nuts, and you're not eating as much as the junk food, and you're not eating as many calories every day, so you're not getting all of these chronic conditions.
Interesting. Yeah.
But,
Michael, that's very true, and not only that, there's several pieces of research that I've come across that has shown that those that are on a weight loss program that actually include raw nuts into their diet are more successful with their weight loss.
Huh, that's interesting.
But does some people just, they go to extremes, though. They think that they can pop a few nuts and then they don't have to worry about adjusting their lifestyle in other aspects. So how do you get them to understand that this is just an avenue that they can help, but they have to do some kind of other procedures to really lose the weight and feel good?
Well, nuts wouldn't be only a part of their diet. Hopefully they would partake of vegetables and fruits and some of the other whole foods. But nuts are a whole food and a wholesome food. It has been processed, at least those that have not been roasted and salted. So raw nuts would be a good choice for you. They do have fiber in them. They're high fiber, and they're also high protein. And that has been shown to be satiating. So eating nuts actually will facilitate, a satiation, and you'll say, hey, you know what? I've had enough. I'm full.
Well, for everybody who's like me and you've heard this advice to change your lifestyle and said, okay, well, what exactly do you mean by that? I think we got a thumbnail sketch of what the answer is. The detailed sketch is over at Strive or up in Gainesville at Request Physical Therapy. Do you guys want to give out some phone numbers? You want to give
Sure will.
Leah's going to do that?
Sure. Yes, at Strive Physical Therapy Center, so you can call our Ocala clinic, which is where Dr. Michael Wood is. It is 352-351-8883. That's 352-351-8883. And then our Bellevue facility as well, where Susan Higgins, she's our doctor of physical therapy there in Bellevue, also does the Physician's Choice Weight Loss Program at her facility. 352-307-1200.
All right, and call us if you need any of that repeated. We'll be glad to do that. Plus, this interview will be up on the Facebook page and up on YouTube, and you guys will be like YouTube phenomenon. It'll go viral. It'll go viral. Lifestyle viral. All right, so one more question. Next week is Thanksgiving. What should I avoid, and what's okay? What's good, and what should I stay away from?
Well, I don't think that there's a blanket stay away from these foods for Thanksgiving.
So Black Friday mayonnaise and turkey sandwich is okay?
Well, maybe a turkey sandwich with
no mayo.
No, yeah, hold the mayo.
Hold the mayo.
Maybe mustard or another calorie-free condiment. But just make sensible changes. You don't have to change everything, and don't feel like you have to change everything at once. Small changes add up. Just like Jeff was talking about 100 calories adding up to 10 pounds a year. The opposite is true. You can make small changes and cut small foods out. Those will add up over the years as well.
Good advice. Well, thank you all for being in here. Jeff Gillum, thank you.
Thank you,
Dr.
Larry.
Michael Wood, Jonathan Holter, you didn't say much, but thank you. And of course, Leah, thank you for being here.
Thank you.
All right, we will take a little break and be right back.
This is a test of the emergency alert system. This is only a test. If this had been an actual emergency, such as a hurricane or tornado, official messages would have followed the alert tones. WOCA serves the Marion County area.